Hey guys, my name is Jeremy and welcome back to another instructional video. Today we're going to be going over the procedure of a cricothyroidotomy. This is what you do when you cannot oxygenate and you can no longer ventilate, and this is the next step. It's important to practice this. I would say this is a quite rare procedure that I've only seen one time, but it's important to know this step so when you're in an emergent situation you don't hesitate and you know what to do to help save the patient. There are two different techniques for this procedure. The first one is the classical scalpel finger Bougie technique, and then there is the needle Seldinger technique. So today we're going to be going over part one of that, the classical approach, and go through the steps. Okay, so for this procedure we're going to need a prop here. So we have a little piece of tape on top of this. We've got a rubber tube, we've got a little piece of tape on top of this which represents the skin. We've got this piece of blue tape which is our thyroid cartilage, this is our cricoid cartilage, and this is our cricothyroid membrane. Next we're going to need our materials. We need a 6 or 6.5 ET tube, going to need a bougie, going to need a 10 or 11 blade scalpel. So for this procedure we need to be sitting at bedside. So I'm left hand dominant. If you're a lefty or a righty, kind of think about what side of the bed you want to sit on for this procedure. You know, whether you're going to be to the left of the patient or you're going to be to the right, depending on what your familiarity is. So palpation-based procedure. So you should be able to do this blindfolded if you're doing it right. So you would palpate with your non-dominant hand, leaving a single finger free to palpate your landmarks. So you palpate the thyroid cartilage with these 3 fingers, and then you're feeling for that cricothyroid membrane. When you get that, that's when you want to do a vertical incision from the thyroid cartilage all the way down to the cricoid cartilage. Feel again, and then that's when you're going to create your scalpel incision. And you're going to go one way, turn it around, and go the other way. So that should be big enough to allow your finger to enter. Again, we can do this blindfolded. So now that our finger is in there, we're going to need our bougie here. So our bougie, with our finger in there, is going to go at a 90-degree angle. So it's not going to start off by going down this way, down the tube. You want it to go alongside your finger and then rotate down. Then you can start pushing in. You don't have to go too far, but just to prove we're in the tube, we're going to come out that end there. So we've got our bougie in. Now it's time to slide our ET tube on. We can now remove our finger. Now we're just going to slide our ET tube down through the bougie. And then as soon as we clear our balloon, we don't have to advance any further. Bougie comes out. We inflate, and then we confirm with capnography we're in the right place. We're not too far in, so we're not doing a bronchial intubation. Some people will advance this far down, and all of a sudden we're going to be in way past the carina, we're going to be in a bronchus, which is not what we're aiming for there. So practice makes perfect with this, but this is one way to perform this procedure. Thank you guys for watching, and stay tuned for the next video.